So hi, my name is Dr. Jack Lambert, and I'm Professor of Medicine at UCD in Dublin, and I'm representing the Lyme Resource Centre in performing these brief educational updates on subjects related to Lyme disease. The subject of today's discussion is to compare another condition that has recently, asserted itself into the medical community, kind of the long COVID, and look at the similarities between long COVID and what patients are experiencing when they get a tick-borne infection and get Lyme disease and do not recover. This is commonly known as chronic Lyme, but similarly we can use the term long Lyme just like we use the term long COVID. In the situation of Lyme disease, in many situations there's persistent infection that is triggering kind of a series of inflammatory and autoimmune conditions. So this is long Lyme, an infectious, inflammatory and autoimmune condition. In contrast, long COVID is a situation where patients were infected with the virus is now dead. So this is a post-infectious inflammatory and autoimmune condition, and there are a lot of similarities. Patients have a lot of similar symptomatology, whether it's long COVID or long Lyme. Initially, we thought that long COVID the complications would be pulmonary in nature. So cardiac and pulmonary, people would be cardiac cripples from damage done to the heart, or they'd be pulmonary cripples with pulmonary fibrosis. But the reality is that in most situations, the condition 100% recovers. Very few people have residual lung disease following recovery from COVID-19. The challenge is that many of them have persistent brain dysfunction. We know that in the setting of acute COVID, about a third of patients have CNS, central nervous system brain involvement, and it seems like the persistent symptoms that continue after you're over your COVID, 3 months after recovering from COVID-19. This is the definition of long COVID. People often have brain fog, head pressures, headaches, concentration problems, things like air hunger, funny neurological problems that all seem to be centrally mediated. So there's a chronic, persistent, post-infectious inflammation of the brain. And similarly, patients with chronic Lyme have persistent headaches, head pressures, concentration problems, energy problems, sleep disturbances. So there's clearly a central nervous system component for long COVID, and there's a central nervous component for long Lyme. In addition, there seems to be some kind of a sympathetic, parasympathetic dysfunction that is ongoing in many of these patients, and we're not really sure where this is coming from, but it appears to be affecting the sympathetic, parasympathetic system. So people often get this postural orthostatic tachycardia syndrome with autonomic instability, fainting, tachycardias, blood pressure elevations and decreases in the setting of long COVID. Finally, we're not really clear, but people get this profound muscle weakness and muscle fatigue and crash. So there seem to be some immune-based disease that seems to be causing patients to crash, extreme muscle fatigue, and we're not really sure where this is coming from. But many people speculate there seems to be some kind of mitochondrial disturbance as well.